Senator Di Natale.
Thank you, Madam Acting Deputy President. I rise today to discuss the future of Australia's healthcare system and indeed the very future of our nation. I want to start by reflecting on the turmoil of the past few days. It was only a little while ago that we had a government that promised it would be grown up, it would be transparent, it would be accountable, it wouldn't deliver any surprises. And I've got to hand it to them. I've got to hand it to them because they've managed to achieve in a year and a half what it took the Labor Party 3 years to achieve. 3 years to achieve. They've got a government that's chaotic, it's dysfunctional, it's divided, it's confused. And you know, I keep hearing excuses. I keep hearing excuses from the coalition. They blame the 24-hour news cycle. It's too hard to get a message out. We hear about the corrosive influence of social media. You know, I think something the Prime Minister calls electronic graffiti. We hear about the mess of the last government. The Prime Minister went as far as to say, it's not my fault, it's the Australian people's fault. In Victoria, he said that the defeat of that government occurred because of a fit of absent-mindedness. It's not my fault, it's the Australian community that got it wrong. Well, I've got to tell you that the people in Victoria, indeed the people of Australia, they know exactly what they want. Nothing absent-minded about it. They're very, very clear. They're very, very clear about how they feel about this government. It's time to stop making excuses. It's time to start taking responsibility for the fiasco that is the Abbott government. And he could have done that last week in that landmark speech to the press club. Instead, what did he do? He went into his bag of tricks, fear-mongering on terrorism and foreigners. He's a one-trick pony. Exploiting fear doesn't work forever. You can run around the country with your billboards talking about boat arrivals. You can run around with your fluoro vests and your hard hats talking about the impact of carbon pollution pricing on the community. It doesn't work forever. The Chicken Little routine doesn't work forever. You know what? Even worse than that, on those things that they campaign so hard on, the tide is turning. He must have realised when he was embarrassed at the G20 that the show was over. Here are a few tips. Start being honest. Be upfront. Be straight with people. Keep your spin for the cricket pitch. Don't promise one thing in opposition and another thing in government. You know, the Prime Minister thinks his only job is to fight the Labor Party. He's the Prime Minister. Start acting like it. He's not in the boxing ring at Oxford anymore. That style of adversarial, negative, oppositional politics, people hate it. I hate it. We're sick of it. And your approach to health, it epitomises everything that's wrong with this government, everything that's wrong with this government. At the heart of this government is a lack of integrity. They promised no cuts to healthcare. In their first budget, a GP co-payment, a freeze on Medicare rebates, decimating Medicare, dismantling it and making it harder for people to go and see a doctor. And what really grates is that you spent years berating the previous government for what you're doing now. For what you're doing now. But you know what? The broken promise isn't the worst of it. It's not the worst of it. It's the policy itself. It's the policy itself. It's a stinker. It's an absolute stinker. It's based on a lie and it won't work. Government keeps talking about how unsustainable Medicare is, that we can't afford it. What rubbish. We have got a great health system. It's affordable and it's sustainable. Don't let the facts get in the way of a good story, though. We spend less than the OECD average on health. We spend about 9.1% by most recent estimates. The average is 9.3%. Look at the Australian Institute of Health and Welfare report. Look at the most recent one. Health expenditure growing at its lowest level since records began 30 years ago. Why does it work so well? Why have we got such a great health system? Because Medicare's a brake on prices. It doesn't mean private health insurers set prices. It doesn't mean doctors set the price. Government sets the price and it's a brake on health inflation. And you guys want to dismantle it. Talk about economic vandalism. But why do you do it? The question is, why do you do it? You're a government that's dominated by ideologues, and you put your own ideology ahead of evidence. You know, this stuff might have read well in some 1960s free market textbooks. It doesn't work in healthcare. It does not work. Look at the model you aspire to. Look at the US. They spend 17% of their GDP on healthcare. What do they get for it? They get a two-tiered system. What's the biggest cause of bankruptcy in the US? You can't afford to pay your medical bills. They get worse healthcare and they pay more for it, and you want to take us there. You want to take us there. You want to make it harder for people to see a doctor. You want to make it harder for people to see a doctor. You want to shift costs onto emergency departments, and you want to do it to those people who can least afford it. What a tragedy that on closing the gap day, some of those communities who'll be worst affected are those Aboriginal people right around the country who are trying to access healthcare. You know, I hear these stories that millionaires should pay for their healthcare. Well, guess what? They do. It's called progressive taxation. They pay more into the system. They are just as entitled to get bulk billed as anybody else. It's an efficient system. Stop trying to dismantle it. And then I hear about the Prime Minister talk about being the best friend that Medicare's ever had. I mean, it's a reflection of a man who is so isolated that his best friend right now is a government institution. Says it all, doesn't it? It says it all. Perhaps, you know, even worse for a government that prides itself on competence is not only did you lie about the policy, not only is it a bad policy, but you can't even get it right. We're up to version 3. We had version 1. We then had version 2 over the summer. We've got version 3 announced by the Prime Minister. We're going to be up to version 4 soon. This isn't a health policy. These are a series of thought bubbles dreamt up by a bunch of blokes smoking cigars and drinking Grange. That's what they are. It's not a health policy. Now, what do we do from here? What do we do from here? Well, it's an opportunity for the Prime Minister right now if he wants to salvage his leadership. He's got to press the reset button. He's got to press the reset button and ditch these reforms. Ditch these reforms. He says he's going to listen. Well, guess what? There's a wealth of information out there. There are inquiries, there are reports, there are recommendations. There's a Senate committee right now looking into, talking to experts, looking into what are the reforms that will improve an already terrific health system. It's going on right now. Let's look at addressing the cost shifting that goes on between state governments and federal governments rather than making it worse, which is what this plan does. Let's look at reforms around the private health insurance industry and stop this massive, inequitable, unfair and ineffective redistribution that's going on right now in the health system. Let's get primary care working better. Let's complement fee-for-service by paying doctors for achieving good outcomes. We can do that. The AMA, the medical community in general, this is a conversation they're up for. Let's start closing not the gap, but the chasm that exists between Indigenous people and non-Indigenous people. And today we've heard we're not doing enough to get that right. Let's start looking after people in the community and provide the supports and the structures that mean that simple things don't end up in a hospital where it costs us all more. Let's reduce some of the wasteful spending that currently occurs in the health system. They're all positive reforms. Our door is open. Our door is open. Come and talk to us. Talk to the experts. I mean, at the very least, you would think that a government with a bunch of crossbenchers in the Senate would pick up the phone and say, is there anything we can agree on? Well, guess what? Not one phone call, not one approach from the previous health minister. I hope things will be different under the new health minister. I'm not optimistic, though. I'm not optimistic. Government's now on borrowed time. Prime Minister's got his last chance. He can start listening to the Australian community, he can listen to doctors, to experts, and he can start doing the things in healthcare that will take us forward, not backwards. If he doesn't do that, it'll either be his own colleagues or the Australian community that make the decision for him.